Okay, good afternoon, everyone. Welcome to the Levinson and Associates Training Webinar. It also happens to be Positive Tuesday, my favorite day of the week. We're going to touch on our Positive Tuesday quote at the end. But I also want to, first off, welcome everyone to our call today and give you a 100-foot overview on what we're going over. I think the timing is perfect for this. I want to welcome Andrew Paris, and our guest speaker, Seth Groff, is joining us, so thank you to both of you. So just a couple things, housekeeping rules. I want to make sure that everybody is paying attention, taking plenty of notes, please, because you're going to learn about a lot of products, okay? I call them the ultimate door openers, especially to sell during this pandemic. And the products that we're going over today, almost everyone in every household needs these products. And I think you'll understand why in a few more minutes. But I also think it's important to understand that the products we're touching on today, these are not going to, let's say you're selling $1 million estate planning IUL and it's going to change your life, for the rest of the year, where you walk away with a $132,000 commission check. These are not those types of policies, but I think they're very important, and in fact, probably more important, because these are used to get the client's attention to say, wait a minute, I need something like this. I've heard about this, especially right now when everyone's sitting around the kitchen table at home, which is almost all day, right, because of everyone working from home, and they're saying, God, what if, mommy and daddy, get a critical illness or a disability, or if they happen to unfortunately pass on from COVID, are we protected? And these types of products spark that conversation. And I feel like it's much easier for you as an agent to talk about a product that protects the family for just a few dollars a month, or $20 a month, or $28 a month, than obviously to go for the grand slam at, $17,000 a month when you're talking about a survivorship IUL or whatever the case is. So the point is, use these door openers to crack the door open, right? Build the relationship. It gives you a chance to get in, and then you can discuss whatever estate planning needs come to the table, right? Or referrals, or the list goes on and on and on. But as you know, most agents right now are working from home, right, over the phone or online. I hope you're doing both. And you need those little food crumbs, right, to sprinkle out everywhere and try to get a prospect on the phone that wants to hear more. And these are the perfect products that will do exactly that. Okay, so that's why I think this is as important or even more important than any other trainings that we have, especially during the pandemic. And Seth is a specialist when it comes to these types of products. We're talking about the new UHOne health platform, and we're talking about the hottest SureBridge products, and then we're going to touch on what other new products are available on the Insure Me Now Direct platform, and we're going to talk about some value add that you can offer as an agent that have nothing to do with insurance products, but it gives you a way in, and these are things you can offer for free to generate phone calls and reply emails. So that's what we're going to focus on today. All right, without further ado, let's jump right in. Now, I had to share this, especially on Positive Tuesday. In fact, this agent's on with us right now, so my hat goes off to you, Eddie. We really appreciate you sending this last week, and it just really meant the world to me, my family, the Levinson and Associates team here. We were touched by this, and I wanted to share it with everyone on the call. It's on our Facebook page, Levinson and Associates. So it just says real quick, hi, Bill. I'm happy to give you the deserved feedback. You and Dad do a spectacular job of managing your great life insurance agency. I find it extremely admirable that the two of you contribute such significant financial benefits, peace of mind, and happiness to many thousands of families throughout our great country. Congratulations on all that you both do together and for what tremendous examples you are of being great men and a very inspirational father and son team. Highest regards, Eddie L. So I don't know. I mean, I don't want to sound conceited and I don't want to toot our own horn, but when you get that, let's say you being an agent from a client or a prospect, right? And we get that from our agent, right? Which happens to be our prospects and our clients. That means so much, okay? We didn't ask for this, and he just took time out of his busy day to share this. And when someone notices, and we all work so hard day in and day out. When I say we all, not just us here, but everyone on the phone. And when someone takes a minute to notice and share a comment or two or a testimonial, it just means so much and it goes so far. So I wanted to share it with you all. I feel like we have this family every week. We jump on these team calls and, we talk about new products and sales strategies. And I don't know, I feel like we're all kind of one. And when I see and feel something like this, I think it's important to share. So thank you, Eddie, for that. And by the way, anyone else that wants to share, obviously feel free to jump on our Facebook page and you can share anytime, any day you want. But no, I think it's important. And listen, the bottom line is we're not perfect. And if there's something that, we need to work on, or maybe a systems error that came up, or whatever it is, a case is taking too long, maybe something held up in underwriting at the carrier level, we want to hear not just the great, but the good, bad, and different, all of the above, because ultimately that's how we built this agency, was around you guys and girls. So please feel free to share anytime. Okay, let's move forward here. So Insure Me Now Direct is revolutionary, and I say that on so many levels. And you look at, I've been talking about this on these webinars for 7 years now. Okay, in the first 5 years, yes, things were good, but not like it is today. So June was our record number of applications. Okay, June, in fact, let's see here, March, April was okay. June, we knocked it out of the park. We had a record number of applications. And a few of the reasons why: number one, we've dumped a bunch of money into marketing and perfecting the platform with technology. So things are bigger and better than ever. We now have 5 carriers on the platform. Okay, we have Gerber on the platform, guaranteed issue whole life, grow up plan, comes with free scholarship. We have the SureBridge products that Seth is going to touch on that also come with free scholarship, except for the dental and vision. There's some great hooks now, and you won't believe this, but the founder of iPipeline, okay, yesterday literally set up a 1-hour webinar with me because he wanted to pick my brain and go over the entire platform, because their family member has their own agency and they want to start to market the platform. So these are the kinds of things that mean the world, and this is why I think it's so important for you all to make sure your platform is up and running and you're marketing to this, because people don't want you to sit at their kitchen table right now on a Wednesday night at 8 p.m. before the kids go to bed. It's not going to happen, okay? This pandemic might have changed our industry forever, okay, which is not a bad thing. Okay, what this means is technology now at the insurance carrier level is at an all-time high. They've never had a process like this before. We've never been able to have 15 different competitive products on our platform like this. So you as an agent need to take advantage and run full steam ahead. This is great. You can literally sit on the phone with your client tonight at midnight if you wanted to and say, hey, Bob, while I have you here on the phone, and I know you asked me about a term quote, go to Insure Me Now Direct /Bill. Okay, click there. Tell me when you're in. Click on term. Run a quote. Bob says, great. Takes literally a minute. Well, wow, I can get $500,000 for $42 a month. This is great, Bill. Where do I sign up? Well, you click that little orange button. It says apply now. And Bob clicks apply now and fills out the app in less than 5 minutes on the e-app. And it says you're approved, Bob. Do you want to print or save your policy, or both? Bob says, I'm going to do both. And you qualified for the free scholarship program because it was one of the eligible products. So now he gets a $40,000 scholarship, right, for his son or daughter or grandkids or any blood relative, just because he's lucky enough to work with Bill the local life insurance agent, okay? Now, that was all done on the phone, but Bob can also do this at 2 a.m. when Bill Levinson, the agent, is sleeping. It's the same exact thing. So that's the way the platform was designed to work. That's how it's working today. We're adding a new term paycheck protection product onto the platform as we speak, and we have the only and the first final expense 100% direct to consumer product that is going on the site as well. We are in the middle of building out the e-app, and that product should be available by the last quarter of this year. So very, very, very excited about that. Within itself, a final expense product on a platform like this is a game changer, okay? And what I would also be thinking about, you as an agent, is recruiting other agents, because they're not going to have access to anything like this, okay? I don't care what kind of marketing BS they're seeing, you know, hey, click here, quote and apply, everything direct to consumer. No, what they don't tell you is there's a call center, fulfillment center, that's talking to your client and doing all the work for you, and you are losing a percentage of commissions for that convenience. But what this does, it cuts out everyone and allows the consumer to go directly to the carrier and buy a product, but you, the insurance agent, still make full commission and renewals when applicable. So think about that for a minute. Never been done in history. Okay, we're the first and only, and you guys and girls should be running with this. And it's free, so there's no gray area here, no small print. Let's move forward, Andrew. I want to jump in to the hot products that are on the platform today. This isn't a dream and a vision 20 years out from now. This is available up and running today. On the left side, we have the first and only instant decision in real-time fashion term product up to $500,000, 10, 15, 20 year, and 30, okay? Everything 100% direct to consumer, the entire process, less than 7 minutes. The Gerber products, we have the Grow Up Plan and the straight up guaranteed issue whole life, all 100% direct to consumer, all come also with the free scholarship. Now, if you're working the senior market, okay, that Grow Up Plan for, let's say, the client, your prospect's grandkids, what a slam dunk. Insurance and 1 year free tuition for a few bucks a month, that's a no-brainer. So anyway, this is how you need to think and market. Right side is SureBridge. They are our main core carrier on the platform, and you can see all the options on the right side. I'm not going to steal any of Seth's thunder, okay, that was a tough one, but he's going to dive into each product and show you all the hot buttons, and then he's also going to talk about the UHOne direct-to-consumer platform, where you as the agent get a link where your clients can literally click and do the same thing. We're actually looking at incorporating that into Insure Me Now Direct as well. So real cool stuff to come. Okay, let's move forward here. Okay, so real quick, I talked about our new paycheck protection product that's going to be on Insure Me Now Direct. This is really, really, really cool. And the reason why, not only is it on our Insure Me Now Direct platform, and it's direct to consumer, but there's not a product that exists like this today, period. And here's why. First of all, it's less premium than any term product, number one. Number two, here's what's neat, especially, again, during the pandemic. So let's say, for example, you're marketing this to a family of four and husband and wife team. And let's say the husband wants to put this policy on his wife, and she's the insured. If his wife passes on, okay, when, I should say, it's not if, because everybody's going to pass on, as we know. So when she passes on, instead of the policy paying a one-time lump sum, the policy will replace her salary for a period of time, let's say 10, 15 years. So let's say she's making $5,000 a month, okay, she passes on. Now the beneficiary, let's say the husband, gets a check for $5,000 a month for the 10, 15, or 20 years, whatever the term length is. So it's a very unique niche. It's called paycheck protection. It's coming soon. We're programming now as we speak, but it's also going to be on the platform. So again, your client can log on 2 in the morning and run a quote themselves and apply. You can wake up in the morning and have your notification that the policy is approved and placed, or you can walk someone through this on a phone call. Or if you're face-to-face with your mask on, you can do this on a smartphone with each other, okay? Literally, 7-minute process. So that's coming. And then also, I want to add, I just nailed down the date. My next podcast guest speaker is the CEO of Haven, okay? His name is UHOne Bensby, okay? He just got rated in the top 5% CEOs in New York City by Entrepreneur Magazine. He's a graduate from the School of Wharton, very brilliant guy. So I'm going to get to interview UHOne for 1 hour. We're going to talk all about technology and why he thinks the perfect time is now to get these Haven products out to agents and consumers. It's going to be really neat. So I'm going to launch that within the next probably 2 to 3 weeks or so. Keep your eyes peeled for that, but it's going to be an awesome, awesome podcast. Really looking forward to that. Okay, let's jump right in. I wanted to tell you real quick about the other hooks that you can use to drive traffic to your platform. So Legacy Armor, that's the online safe deposit box, okay? If you're in the VIP plan, you can offer this to every client for free. Basically, it's a platform online, a secure vault, if you will, that's backed by artificial intelligence. It gives your client a chance to store all of their life insurance policies, all of their annuities, all their bank accounts, passwords, user IDs, pictures of the family, Christmas time. Let's say maybe there's special instructions that there's a treasure chest buried under Aunt Audrey's house in Tamarack, and here's the address. And when I pass on, I want you to go get the treasure chest. Your client keeps everything in the secure vault. When they pass on, their beneficiaries are automatically notified in real-time fashion. They get a ping, okay, that, hey, Aunt Audrey passed on, and here's all of her information she wanted to share with you. Okay, so now you have access to everything, including her life insurance, carrier information, policy number, passwords, everything. It takes all the guesswork out, and you could just imagine, okay, we have these consumer videos for marketing. You can imagine the kind of traffic that this will present, right, if you offer this for free. So anyway, some really neat marketing ideas around Legacy Armor. It's also direct to consumer on the same platform. Now, in the middle section, identity theft. Okay, that's a big topic right now. We have the top ReliaShield product, again, direct to consumer, and every agent, okay, if a product is sold on your platform, you get a marketing fee or compensation for every sale that's made. On the right side is the scholarship program. Now, especially when you're talking about the SureBridge products, when you're talking about like guaranteed issue, the grow up plan, there's so much value add here because you're not just a life insurance agent, you're a college planning professional now, right? And you can discuss college savings. We have a whole tutorial all built around training our agents to specialize in college planning. We even have a website resource that has every college on the platform. So it gives you a chance to sit down with your client and do this over the phone and walk them through whatever college is best, the best policy to be used to fund college. The list goes on and on and on. So, and this is all free, by the way. So make sure you take advantage. As long as you're active with us, it's free. All right, let's move forward. Right before we jump into the feature presentation, just wanted to give everyone a overview of Insure Me Now Direct and what your client's going to see. So some of these special add-ons, I call them the value add. On the left side, your client clicks whatever topic they want to look further into. On the right side, if they click scholarship rewards, they just click that little bullet there. It says 25% off college tuition rates. Boom, your application is ready. What's the price, everyone? Free. Apply now. Done. Your client just did this while you're sleeping at 2 a.m. Okay, and they're happy as a clam because you just came through with this value add package that no one else was able to offer them. No other life insurance agent. Okay, so remember these things. These are the differentiators. And I know and it sounds a little confusing, and but think about this. Okay, if you say, wow, there's so many moving parts, actually there's not. We built this to be like Amazon, okay? If you send your client here, okay, and they know how to open and close an email, they can move throughout the platform and buy a product, okay? And again, use that as the door opener to then pick up the phone and say, hey, I saw you bought a $100,000 term policy or a critical illness guaranteed issue policy from me. Can we talk about what other needs you might have or what other people you might know that I can help? Okay, so again, think door openers. Okay, without further ado, I want to jump into our feature presenter, my friend Seth Groff. He's been with me for many, many years now. Great presenter, and he's great with the door opener products with UHOne and SureBridge. Seth, you there?
All right. Well, thanks, Bill, and thanks for that warm invitation. I appreciate everyone jumping on today's call. I'm always excited to hear what's new at Levinson's and Associates because I'm always impressed on all the tools they give their agents that are ultimately free. As Bill said, those things are the differentiators. You know, everybody has products and can talk about life insurance, health insurance, or even ancillary products, but those additional benefits that you can provide through getting contracted with Levinson and Associates are second to none. So you might be a little confused. You see up on the screen, it says the title of today's presentation is UHOne Short-Term Medical, but down in the lower left-hand corner, it says SureBridge. And if you've ever been on one of my presentations before, when I presented on SureBridge, you know that SureBridge is one of the fastest growing ancillary carriers in the marketplace. But however, there's been a recent development in the relationship between SureBridge and UHOne, and now we have the ability to bring you both product lines through Levinson's and Associates, and really it's going to be a win-win across the board. So I'll get into a little bit more detail about the relationship, but now if you're contracted with both SureBridge and UHOne, you're going to be able to offer the UHOne products on SureBridge's point of sale tool or direct to consumer through a link, which we'll talk about as well. But for those of you that don't know, SureBridge, underwritten by the Chesapeake Life Insurance Company, was purchased by United Health Group during the first quarter of 2019. And United Health Group is a huge company, and it operates in several different markets. These include group major medical sales, senior products, and UHOne. Then UHOne focuses in the under 65 market. And now SureBridge has combined teams with that UHOne division of the company. And what I always tell people is that it's a perfect match. And here's the reason why. UHOne has primarily been focused in the under 65 market, specifically on their short-term medical plans. And as you know, SureBridge has a wide range of products that compete in both the under 65 and the over 65 ancillary market. So by working together, SureBridge filled a void for UHOne with products in the over 65 market, and UHOne added a missing piece to SureBridge with the addition of these short-term plans. And so as the healthcare market is constantly changing and ACA plans are not always the best fit for the clients, also clients are having to move to higher deductibles and higher coinsurance and higher out-of-pocket maximums to keep plans affordable. So consumers are looking for strategies to help cover some of the out-of-pocket costs associated with their core plans, whether it's a short-term or tri-term medical plan with UHOne. So these strategies are going to get better if you offer a short-term plan in conjunction with an ancillary plan. And I am confident that with the addition of the UHOne products to the point of sale tool, you will be able to offer innovative solutions to your clients. So what we're going to talk about today, first of all, is we're going to talk about UHOne's tri-term and short-term medical, and then we'll jump in and we'll talk about SureBridge's top ancillary products. But if you're not familiar with tri-term and short-term medical, from a price point, you can kind of see where it fits in the marketplace. The ACA plans that are sold through the marketplace, they are going to be typically the most expensive option for the clients. They're also going to be the most benefit rich. But the short-term and tri-term medical, you can see, are going to be at a little bit lower price point. And what you're going to find on today's call is that these price points are still going to come with a lot of the benefits that your client's looking for. But this just kind of gives you an idea of the savings that you can provide to the client if they move to a tri-term or short-term medical plan. The other thing that I like about the short-term and tri-term medical plans is that they can be sold year-round. right? The ACA plans, generally speaking, have to be sold during open enrollment, which is always fourth quarter. And obviously, we do see a spike in the sale of these products during the fourth quarter. But as you can see, we still have pretty flat sales year round. And so it's not a situation where you have to wait until open enrollment for your client to qualify. As long as they're relatively healthy, they can apply for these plans year round. This is also going to generate you a more consistent payroll, because you're going to be selling these plans and earning commissions year round versus lumping everything up during the fourth quarter. But if you're not familiar with what a short-term medical plan is that it's typically going to be a plan that is going to stay in force anywhere from 1 month to 12 months. Okay, and in some states and some scenarios, you can do back-to-back plans, but generally speaking, it's going to stay in force from 1 month to 12 months. And up on the screen here is going to be the availability of the short-term plans. Actually, down in Florida, we have 2 different types of plans available, both Gen 5 and Gen 6, and we'll talk about the difference between the 2. Otherwise, you can see that we have a pretty big footprint with these plans across the United States. But really, here are going to be the people that will benefit from short-term medical plans. First of all, it's anybody that's looking for an individual health option, right? If they don't have health insurance through their employer, short-term medical might be a temporary solution for them. But where we're seeing a lot of these sales coming from right now are with the unemployed, right? Due to this pandemic, a lot of companies are having to lay off employees. They've canceled their health care. And so now these consumers are like, what am I supposed to do? Well, they can purchase a short-term plan, and this short-term plan can be a bridge until they find another job or until open enrollment hits and they buy an ACA plan. So really, the unemployed market right now, with people losing their jobs, unfortunately, has been a huge market for us. Also, self-employed. A lot of times, self-employed workers are looking for a temporary solution as they build up money so that they can afford maybe a more comprehensive plan. We sell a lot to that. Also, seasonal workers, bridge to ACA, open enrollment. Trailing spouse in a senior market is another popular market for us. If you have a husband and wife and you sell, senior products, whether it's Med Sup or Med Advantage plans, and then one of them turns 65 and enrolling in Medicare, and they had the health insurance through their job, and now they lose it and their spouse loses it, that trailing spouse that might not be 65 yet is going to need a solution, and we sell a lot of these in that marketplace as well, as we do with students and recent grads, right? All these kids graduated in May, right? And they're having a tough time finding jobs just because the job market is just real tough right now. Well, this is a good solution as they get kicked off of their parents' health care to enroll in this as they find health insurance through their employer. Also, individuals without citizenship, all we require are 12 months living in the United States to qualify for this plan. So pretty easy to qualify. A couple of important caveats with these plans that always come up. First of all, pre-existing conditions are not covered, period, okay? With the short-term plans that are 1 month to 12 month, pre-existing conditions aren't covered. So you have to keep that in mind. And also for the Gen 5, there is a 5-day wait for illness, but not with Gen 6. So if that's a concern, you can go in the other plan in Florida. But the thing you have to realize is that, the difference between an ACA plan and short-term medical plans, there are give and takes, right? ACA plans are guaranteed issue, right? So everything's covered. Also, they have something in place that is called minimum essential coverage. That means that the government says what benefits have to be in place. For example, pregnancy, right? That's part of minimum essential coverage. So everyone has to pay for that, right? Even if that's not a concern to you. But with short-term insurance, it's going to be lower premiums. And that on that one slide where I showed the price points, it's pretty significant in the amount of savings that you get. However, you need to point out to your client that it's not minimum essential coverage, and there's also going to be some simplified issue underwriting involved. But the trade-off, you just have to be upfront about what's covered and what's not, and you're going to find that consumers are going to see a lot of the benefits that they're looking for in these short-term plans, and they're going to like the cost of it. One of the biggest selling points to these plans, whether it's a short-term plan or a tri-term plan that we're going to talk about in a few more slides, is the network, okay? When you purchase this plan, a UHOne plan, tri-term or short-term, you get access to United Healthcare's Choice or Choice Plus network. And this is the largest network in the United States. It has access to, 1.2 million healthcare professionals, 85% of the hospitals nationwide, and your clients get up to a 50% discount by going in network. So one of the number one selling points to these plans are that you get access to these networks. Now, depending on your state, it's either going to be Choice or Choice Plus. The difference between the two is that Choice is what's called an EPO or exclusive provider organization. What that means is that if you need service and it's not an emergency, you need to go in network, okay? Because the only thing that will be covered out of network is going to be emergency care. Choice Plus is going to be a PPO. So if you go in network, you're going to receive some discounts, but there are going to be some benefits if you go out of network. In Florida, with the short-term plans, it actually uses that Choice network, so that EPO. But again, it's one of the largest networks in the nation. So chances are their healthcare provider are going to be in network. And so it's a great option, but I will tell you that in Florida, it is the Choice network. And so if it's a non-emergency, they do need to go to a network provider in order to receive benefits. But I'm not going to spend a lot of time on the coverage details, but I kind of got to give you an overview of this so you have a better understanding so you can go out and start talking about them to your clients. As I mentioned, there's two short-term generations available, Gen 5 and Gen 6. And in Florida, both are available. The reason both are available is because, they launched Gen 6, and sometimes you always think that newer is better, but some people like the benefits of the Gen 5, and so the state let us keep both, and so we just kept both. But as you can see, there's going to be 3 options within the Gen 5. The general rule of thumb, as you go up, the benefits are going to get better, but the cost is going to get higher as well. So the value select would be the most cost effective, plus elite is going to be the most expensive. Up on here, you can see you're going to have to choose your deductible, and then you're going to select your co-insurance if applicable, and then your maximum out-of-pocket cost, okay? If all your client wants is to pay the deductible and be done, they don't want any co-insurance beyond that or any maximum out-of-pocket cost, go with the Plus Elite, because basically you select your deductible. Once you hit your deductible, you're good. Otherwise, if you select the value or Plus Select, you have to choose your co-insurance, which then after you hit your deductible, you're responsible for the co-insurance up to the maximum out of pocket. Now, the biggest thing that you have to realize on these short-term plans are that doctor office visits are going to be subject to the co-insurance and deductible. So if they go to the doctor's office, they're just going to have to pay for it out of pocket up to their deductible. Now, when we talk about the next generation of products, there is an option in there where they can get some copays. However, there's only a $75 copay if they go to an urgent care center. And so you can see that with these plans, we're really trying to push people to go to that urgent care because it's only going to be that $75 copay. And so that's just a more cost-effective way for us to conduct business. And, there's an unlimited amount of those. And so if the kid's sick, they can go to the urgent care, see a doctor there, get some medicine, and they're going to be good to go. Just make sure that the urgent care is in the network. Otherwise, you can see what else is covered. It's generally speaking, it's going to be very similar benefits to the other health plans that you're familiar with. Most of the time for the benefits, you're going to be subject to the co-insurance and deductible. As far as RXs are concerned, the value select only has a discount card. The preferred and the plus and the plus elite do have a $3,000 benefit for prescriptions. However, they do have to hit that deductible and the co-insurance, and then that would be available. So that's how the plans how the plan is going to look. For a full list of benefits, I always recommend looking at either the brochure or a sample policy, because that's going to outline what is covered and what is not. A couple of big things or talking points with this Gen 5 product: if you pay in a lump sum, so you purchase 6 months worth of coverage and you pay in a lump sum, you can get up to a 24% savings. And if for some reason you buy 6 months and you only use 3 months, you get your premiums returned, which is nice. Gen 6, There's going to be 4 plans available. I just want to point out one of these, and then we'll kind of talk about the subtle differences. The one you want to take a look at if your client does want copays for doctor's office visits is going to be the plan that's called copay. Okay, pretty straight, pretty self-explanatory there. They get the $75 copay for doctor's office visits or the $75 copay for urgent care. So if that's something that's concerned to them, this would be a good way to go. Also, the prescription benefits on these plans are going to be a little bit better. You can see that, like on these, your tier 1s only have a $25 copay, and then tier 2 through tier 4, it's going to be subject to the coinsurance and deductible. Plus Elite, again, pretty straightforward as far as what's covered, what's not. It's going to align. It's just having a little bit higher copay and higher out-of-pocket costs, and then the least expensive value is what people are going to go with, if they're not looking for any prescription benefit, because again, this just comes with that discount card. So here's really going to be the differences and that you need to look at to really decide if your client's better for Gen 6 or Gen 5. And also, I recommend going out and playing with the quoting system and seeing which one aligns with their benefits. Gen 6 is always going to be sold in months, okay? So 1 to 12 months. Gen 5 can be sold in any number of days from 30 to 360. The Gen 6 does have some plans available that are 2x12s, and actually Florida has been approved for the 2x12. That means that your client can enroll in back-to-back short-term plans, where the government has a limitation on how long somebody can be enrolled in one of these plans. But with Gen 6, and if it's an applicable state, you can actually do back-to-back 12 months plan. App fee, Gen 6 doesn't have one, Gen 5 does. Gen 6 only has the monthly option. And then as you kind of go down, you can see that the Gen 6 has a little bit richer benefits for air ambulance, for your spine and back prescription, and your prescription max. And so generally speaking, your Gen 6 plans are going to be a little bit more expensive than your Gen 5 plans, just because it has a little bit richer benefits. So it really depends on what your client's looking for which one you align them with. But again, you can quote both of them side by side to kind of see which one you prefer for your clients. Just some other information, 19 to basically 64 and 11 months. Dependents can be on the plan up to age 26. And it's going to use simplified underwriting. Basically, phase 1 of the underwritings are going to be questions on the application. These are going to be knockout questions, so always look at the timestamp on these. Pretty straightforward on what they ask about, but they got to be pretty sick to not qualify for this. Second, they have to fit in the height weight table. There is no gray area on the height weight table. They're either in or they're out, so always refer to this on the application. And then phase 3, since we have this huge database of claims through United Health Group, whether it was on a group medical or on a short-term plan or back when they had an individual plan, we do ping our database of claims, and so we can tell if somebody's lying on the application if they've had a United plan in the past. So basically, application, height weight chart, and then we ping our own database to see if they qualify for it. The next product, real quick, Tri-Term Medical. This is one of the fastest growing products at UHOne. The reason for it is because the client can apply for basically a policy that they can keep in force for just 1 day shy of 3 years, okay? And so also, this plan will cover some pre-existing conditions, and we'll talk about that. So this is kind of like a longer term, short-term plan. So, somebody says, well, that short-term plan only will cover me for 12 months. Well, this tri-term plan basically has 3 different terms that gets them almost to three years. As you can see, pretty wide range of product availability. We think it's one of the best non-ACA coverages out there just because of the length of time and the fact that we do cover pre-X after 12 months. Also, we got some great RX benefits built into it and access to the same networks that you get with your short-term plan. But basically, up on the screen, number 1, we moved a lot of the moving parts out of these. You select your deductible, and then depending on the plan you choose, that's going to be your coinsurance. So again, your plan 100 max, once you hit your deductible, there's no more coinsurance or out-of-pocket costs. Plan 80, you got 20% coinsurance up to $2,000 out of pocket. and with the copay plan, you got 30% up to $4,500. So that's how it's going to work. One of the nice things about the copay plan is that they do get $75 copays for the first four visits. They still get the $75 urgent care. And so, you know, people wanting that doctor office visit copay, you might direct them to this copay select max on the tri-term, because again, you're getting coverage up to just shy of 3 years. Otherwise, you know, again, with the copay plan, you get a $25 copay for tier 1. Then there is a $500 deductible for your tier 2, 3, and 4. But tier 2 only has $50 copay, tier 3 $75, and then 50% after that, after your RX deductible. So some great benefits built into these plans. My recommendation, I apologize, I have to go through this pretty quick so that we cover all the information that we want to today. But my recommendation is get contracted with UHOne. Once you're contracted, go out. We have detailed brain charts where you can go through all this. You can download the brochures. You can study all the details. But generally speaking, it's pretty straightforward as far as what is covered with these plans. With that, you know, the biggest thing, remember that these aren't minimum essential coverage as defined by the ACA, but they have a lot of the same benefits built into them. Also, it's one application that's going to cover them for 3 different terms. So you just get them 1 day shy of 36 months. And the pre-existing coverage or conditions will be covered after that first term. You know, why it says pre-X may be covered, and people always ask, what's that mean? May be covered. It's covered as long as you didn't lie on the application about something, right? So after that first term is over, you will be covered for pre-X as long as it wasn't originally a knockout and something you lied about on the application. So pretty straightforward. Also, in order to sell these plans in some states, and Florida is included in this state, but it just depends. You have to look at the state product approval list, but in some states, they have a FACT membership tied to it. And FACT is a Federation of American Consumers and Travelers. Again, we had it tied to an association in order to be able to sell it for the state. Basically, there's an extra $4 a month baked into the premium, but they get some pretty good benefits with some accidental death benefit, travel discounts, also, you know, some discounts at retail stores. And so they get some benefits for it, but it's like you're either in or you're out. They don't get a choice on it if they want the plan in their state. So just be aware of that if people ask about it. Now, we talked about those great short-term medical plans. Well, what about SureBridge's portfolio, right? What about all these ancillary products, the accident plans, the illness plans, the dental plans, the disability plan? Well, up on the screen is kind of a screenshot of the plans that are available on the Insure Me Now Direct platform. The ones that have a GI next to them mean that there's some sort of guaranteed issue benefit available. It might not all be guaranteed issue, like on CI-wise, the critical illness plan only has a $5,000 or $10,000 GI benefit, but it does have a GI benefit. Otherwise, all these other plans are going to be guaranteed issue. The ones that are highlighted below, so accident companion, prime DVH, CI-wise, hospital-wise, these are the plans that I would focus on if I were you. And there's a couple reasons for it. Number one, these are the plans we primarily sell. Number two, these are the ones that are the easiest to direct market to, okay? You know, as much as I'd like you to sell a Protect Fit plan, it's just a little bit more confusing. And so if you're driving someone to your Insure Me Now Direct platform, it's a little harder to get that message through. But I'm going to hit on just a few highlights of these very fast and then wrap up this presentation. But accident companion, who it's for, really what it's going to do is it pays a lump sum benefit directly to the insured for a covered accident, okay? And it can be used to pay deductibles, it can be used for co-pays, or just as the client sees fit. And it's really designed for active individuals and families. So think about your families that play sports, like to go boating, like to go hiking, maybe ride a motorcycle. Those are going to be great ones. But here's how the benefits work, okay? The primary benefit that they're going to be concerned about is going to be the emergency treatment benefit. Basically, they go to the emergency room or urgent care due to an accident, they would get that $1,000 per injury, okay? After that, if they need a major diagnostic exam, so let's say they blow their ACL playing soccer, they need an MRI, boom, they get another $1,000. At the emergency room, they say you need to go follow up with your primary physician, there's $100 for that. The primary physician says, hey, you need some physical therapy. You get $100 per visit every time you go to the physical therapist, up to 5 visits for the policy year. So you can see that right there in that scenario, you're getting anywhere from $2,000 to $2,500, very rich benefits. Also, $10,000 if they're confined to a hospital following an accident. So they get in that car wreck, go to the hospital, they're confined for a day, boom, they get $10,000, and that cash can be used as they see fit. So that's our #1 selling accident plan. Critical illness, if you're not familiar with what critical illness is, it pays a lump sum benefit to the insured for the first diagnosis of a covered condition. So for example, your cancer, your heart attacks, your strokes, okay? And the benefit can be used to pay deductibles, co-pays, travels to cease benefits, experimental treatment, replace income while recovering, or just as the client sees fit. And it's really for individuals and families interested in removing the financial stress associated with the covered condition. And, you know, a couple highlights of SureBridge's plans. #1 is, remember, wide range of issue ages, okay? So this plan can be issued anywhere from age 0 to age 90. Also, we got a 3-category approach. So they receive the benefit one time in each category. So, you know, if they have a heart attack, they'd receive it in the heart category. If they, you know, then have cancer, they'd receive that benefit. Then if they have a major organ transplant, they would receive that benefit. Or you can carve out different conditions. So if somebody's not concerned about, you know, getting cancer, just sell them the heart and the critical condition. So a lot of flexibility there, but you can receive that benefit up to 3 times if you have all 3 categories. Also, we have that guaranteed issue amounts. Remember, this can be the 5 and 10,000 benefit amount as guaranteed issue, and I think that's available up to age 63. And then also there's no reduction in benefits. So if you purchase a $100,000 critical illness plan on Simplified issue, you still keep that $100,000 benefit, which is pretty nice. Hospital-wise, you know, with the pandemic and COVID-19, this has been our top seller. The reason is people are concerned about getting confined to a hospital, right? You're diagnosed with COVID, you have to spend a week in, you know, in the hospital. You might as well get paid for it. But what it does is basically pay a benefit to the insured for hospital confinement resulting from sickness or accident, and it's customizable with 7 riders. And again, benefits paid directly to the consumer. They can use it as they see fit. And you know, really the selling points for this, #1 is going to be the flexibility. Remember, the several different benefit amounts, several different benefit periods, and wide range of issue ages, right? Also, you can customize it with one of the riders. So there's a lump sum hospital confinement rider, outpatient surgery rider, skilled nursing facility, ambulance transport rider, emergency care, outpatient diagnostic, even a wellness benefit. So the point is, very customizable. You can get in there, play with it, see what's best. Last plan real quick, and then I'll wrap this up because I know I'm pushing up on my time, is Prime DVH. DVH stands for dental, vision, and hearing. This is a combo product, and it's really, we've seen sales increase dramatically with this. One of the reasons for that is #1 is that, especially like with your older clients, it's not a question of when they need dental or vision or hearing benefits. It's not if, it's when, right? Eventually one of those 3 things are going to go bad as you age. And so you're going to need some of this care. And so they like that. They also like the immediate benefits that are available with these plans. Some of the best talking points for this is that #1, your routine dental, vision, and hearing exams are covered at 100% day 1 with no waiting period. So just wrap your mind around that. You get this plan, you pay 1 month premium, you get your ID card, you go to the dentist, get your teeth cleaned, you go to the eye doctor, or the optometrist, get your eyes checked, and you go to that audiologist and get your hearing checked. Also, some great networks tied to it. We use Carrington Network for the dental portion, True Hearing for the hearing portion, and the vision portion, you actually don't even need a network. You can go to any provider and we'll reimburse you the cost. But, you know, we got very affordable coverage, and this is actually priced better than our standalone dental plan. And a lot of times you get better benefits. And so that's why I always direct people to the Prime DVH. But anyways, those are the 4 products on the Insure Me Now platform that I recommend you take a look at. There still is a summer sales incentive going on for UHOne agents. So if you're not contracted with UHOne, and we'll talk about how to do that on the next slide, there's still time to qualify for this. But basically, you get an extra $50 for every short term you sell and $150 for every tri-term, but you do require a minimum of 10 applications. So if you're going to qualify, you better get contracted fast and start selling because it's almost over. However, all new agents, and this is if you get contracted through Levinson's and Associates, new agents that get contracted through Levinson and Associates, if you sell 2 policies within the first 60 days of having the UH1 contract, you actually get a $100 bonus. Okay, so if you contract through Levinson and Associates, you sign and you submit 2 applications, short-term, tri-term, or even any of the UH1 products, 2 applications during the first 60 days, you get a $100 bonus. So you want to take advantage of that. But how you get started? Number 1, get contracted with both carriers through Levinson's and Associates. So call your sales rep there at Levinson's. They'll be able to walk you through the process. You know, if you don't want UH1 and only want to do SureBridge, I'm okay with that. If you only want to do UH1 and not SureBridge, I'm okay with that too. The one thing that I will point out is that SureBridge does pay your appointment fee in your resident state. UH1 does not. So don't let that be a shell shock that you actually have to pay your appointment fee for UH1. Now, with that being said, again, they bonus you an extra $100 if you submit 2 apps. So never hurts for, you know, the agent to have a little bit of skin in the game. Once you get contracted, here's how you can quote the products or sell the products. Okay, with SureBridge, all the products are going to be available on the SureMeNow Direct platform, or you can sell them through SureBridge's point of sale tool, www.supsportal.com. Okay, so it's up to you. If you direct them to SureMeNow Direct, great. If you go otherwise, you can use the point of sale tool as well. We've been having a lot of success though with the SureMeNow Direct platform, just because that client can enroll at their leisure and don't have to have you involved. With UH1, you can, again, as we mentioned earlier, with UH1, you automatically get a link that you can put on your website. So as long as you have a website, you can put a link out there and, you know, send your clients to that link. And if they enroll in it, you know, you'll get credit for it. We're trying to incorporate that into the SureMeNow Direct platform, but it's not available. But you still get that link if you want to put it on your website. Otherwise, you're just going to have to go out to UH1 and enroll through there. Now, if you want to sell SureBridge and a UH1 product on the same, you know, same kind of quote, you can do that on supsportal.com. That's why we were talking about it today. So point is, several different sales methods, several different ways to sell these plans. I should mention that SureBridge's and UH1 plans can be sold, like I said, online or over the phone. So there's really no excuses for not being able to sell it if you can't meet with clients, because you can still sell these plans without seeing the client. So with that, my last piece of advice, dive in. Don't hesitate. Just learn the products and go out and get contracted and get started. Do it before open enrollment, because that's the hot time of the year to sell both the supplemental plans and also the short-term plans. So with that, Andrew, I'll turn it back over to you.
That was great, Seth. Spot on. By the way, take advantage of that $100. So 2 apps, $100 cash. I didn't even know about that. In fact, Seth, you got to send me the flyer on that, because I'm going to get it out to everyone. All right, Andrew's going to take the wheel. He's going to skip around a little bit because we want to end at 5 minutes like we promised. But the point now is you have the great products. How do you market, right? How do you drive traffic? And Andrew's going to dive in right now. Drew?
Yes, sir. Thank you, Bill. Appreciate that. I am going to speed through this for the sake of time, but I will get all of your questions answered by calling in if needed. But this is how you get started with the Sell While You Sleep and SureMeNow Direct platform. You're going to go to our website under the Products tab, click on Sell While You Sleep, and you can follow the steps 1 through 3, complete the appointments. We'll build your website absolutely free for you, and then we can start marketing these products. Real quick, I'm going to show you a screenshot of some different techniques and tools that we offer to our agents to help you drive traffic, right? That's the name of the game. If nobody knows your website's out there, it's not going to do you any good unless you're marketing it. So these are 3 awesome different technologies that we offer to you. I can't go into severe detail now, but call our marketing team. We will help you set up a plan. Here's a snapshot of some of the retail websites, social media, and digital marketing solutions that we offer. Everything that we offer is either complimentary or at a heavily reduced subsidized co-op rate, okay? So take advantage of the things that we've put together for you on the Levinson and Associates website platform. Here's just a quick snapshot of our AssureWorks. This is a targeted marketing technology. I won't dive into details, but basically this allows your ad to show up on search engines like Google, Bing, Yahoo. You know, if you want your ad to show up when people search for life insurance, don't pay SEO companies thousands of dollars when you can use our co-op rate as low as $59. Okay, so contact our marketing team. We'll help you develop a plan for AssureWorks. Also, we have our agency automator. Many of you are already using this. If you're not, you need to be getting involved in this because this drip markets to your clients your Insure Me Now Direct website automatically. It's 100% automated, so you can set it and forget it, okay? So just get involved with this. We have a lot of templates in there ready to go for you. Also, this is huge. We have some new custom videos that we just came out with, okay? So these are only $15 to $25 depending on which video you choose. We will customize the video for you with your name, your logo, and your contact information so you can blast it out to your clients. And if you're recruiting agents, we can do that as well. So definitely get involved. We have a nice new living benefit video. That's a huge seller right now is the living benefits products. So definitely contact us. We'll help you set up these custom videos, and we'll send links in the email that we send out later today to get started. Also, here's a quick sample website of one of our agents who set up their Insure Me Now Direct page right off of their website, talking about how you can use this for employee benefits. This is one of the many ways that we recommend that you market Insure Me Now Direct, but there's many ways to do it. This is one awesome way, and kudos to our agent who came up with a really unique way to market this to their existing client base. Here's our new training section. We have awesome new training videos for Insure Me Now Direct and e-apps and tele-apps and direct-to-consumer marketing, and everything that you need is all in one place on our new iGenius Training Center on the Levinson and Associates website. So definitely check out that new content when you can. I'm going to go ahead and get it back to Bill to go over some ways to drive, boost some traffic, and wrap up with our Positive Tuesday. Bill?
Thanks, Andrew. And I know there's a lot of moving parts here. We're talking about a lot in a short amount of time, but I think it's important that if you see something that stood out, obviously, reach out to us. Just let us know. Any one of our marketers can help you. We have 9 marketers now, okay, 4 remote, 5 in-house. We're here to help. These are different ideas in ways that you can market and network your Insure Me Now Direct platform, okay? And keep in mind, we can co-brand the site for that specific health agency, property and casualty agency, association, small group, maybe an employer wants to offer this to their employees, okay, and then use the free scholarship as the added benefit by working through that group or association or employer. There's so many different spins, and I hope you're jotting down some ideas right now. Okay, the Bill Levinson Experience, like I said, the latest episode is Mary Reed, and I'm telling you right now, we've had some monster cases come out of that already. I've never seen anything like it. She uses Life of the Southwest and Lafayette Life as the 2 go-tos for IUL and whole life with her tax saving strategy and her retirement planning strategy. It's amazing. And I'll tell you what I'll do. Leave a comment on our Facebook page or on your favorite podcast channel, okay, on the Bill Levinson Experience show. And I'll send you a free copy of the Mary Reed book that talks about distribution solutions. And then don't forget, UHOne is the Haven CEO coming up for August. So great stuff to come. Okay, another great incentive. We spoke about Haven, the easy term, instant decision up to $500,000. There's nothing easier in the term part of the industry, period. Write your first step, you get a free tablet. That simple, done. Move on, Andrew. This is a big one, probably one of the most important slides of the day. We are relaunching our co-op discounted lead program platform, okay? We have brand new exclusive annuity leads on the right side. The co-op price is $45. These are people that are ready to talk about annuities and investing with annuities sold from you. Left side, the mortgage protection co-op discount program is back. Okay, as you know, rates right now are at an all-time low in the mortgage and refi world. So that means lead costs dropped and more leads are available. So we have a leads webinar training, period. Next Tuesday, same time, same place. Make sure you're on that call. It's going to be all about leads and selling for the Levinson agents. Okay, we're just about done here. I know I'm running 1 minute late. So all those platforms that Andrew touched on, we have a webinar every day of the week, and these are built to help you get comfortable. So all you have to do is go on the training calendar on the Levinson website. You'll see everything listed. Make sure you're on it. This Thursday, we're actually picking apart the top hybrid life LTC products sold during the pandemic. That's Thursday, 2 p.m. Make sure you're on that. And then, of course, the big one on Tuesday, all about leads. Okay, our last slide of the day. I want to thank everyone for taking the time. We'll end on a positive note because it's Positive Tuesday. Grow so fast that your friends who haven't seen you in months barely know who you are anymore. Growth equals success. Okay, success isn't fancy cars, fancy homes. It's all about you growing, right? Fancy cars and fancy homes and fancy jets, it never ends. There's always another level. So the ultimate in success is for you to keep growing and learning and innovating and reinventing yourself, especially during a pandemic. With that said, thank you again. We'll see you Thursday. Take care, and thanks to all of our presenters. Thank you.